All right, hello there. It is Dr. Daniel Hockenberry over at Ried Physical Therapy. Just going over some of the frequently asked questions we get here at Ried involving shoulder pain. So one of the questions we often get is there any ergonomic adjustments we can make at home or work in order to prevent shoulder pain or prevent exacerbations of existing shoulder pain? So that's actually a great question. So this one way this can be addressed is a lot of people believe that if you actually elevate your chair, you get your arms up a little bit higher, sometimes you can take some of that strain and reduce it on your shoulders. Often it's actually counterproductive. So what we may be doing in that instance is actually elevating the shoulders, leading in some more tightening here in the upper part of our neck, actually our upper trap muscles. It also can lead to additional tightening on the posterior neck musculature, so leading to that more forward head posture. So if we kind of tend to sit in this position and we start to get our head forward, we can start to put a lot of strain on those posterior neck muscles, and instead we start to really lose a lot of strength here in the front area. So a way that we can kind of prevent that would be to really make sure we're working in an ergonomic fashion so that we're able to actually bring our shoulders down so they're more in a relaxed position. I always say elbow at about 90 degrees. And then what we can do is actually have the shoulders sit kind of back. What this does is it reduces a lot of that roll of our shoulders forward, a lot of that strain there through the front of our neck muscles, and allows our body to kind of relax a bit more. So if we do have some type of shoulder pain or something that tends to be worsened whenever we're sitting forward like this, what we actually can do is tend to sit in more of a relaxed position for more prolonged periods of time. And what that's really, really good for is reducing that strain up on that shoulder joint, but as well as decreasing a lot of the tensing you get through those muscles that are trying to kind of protect that area if we do tend to sit in this position for long periods of time.